Presentations now.
Yeah, 30 minutes is about max for me. Me too.
What'd you say?
Me too.
What'd you say?
30 minutes is about max for her, and I said, me too.
I know.
40 maybe on a good day.
I know. We're going to have people asking questions. So.
Yeah. We'll let you take it away.
I think Aisha is the CEO.
Well, we are
I'm a
thrilled
director.
to welcome all of you to today's Diversity Dialogue, put on by YWCA Northeast Indiana, and engaging 3 local panelists who are experts in healthcare and racial disparities around those. So some things as we welcome you today to know. We have some group rules that we like to use at the dialogues to help make sure that our conversation is productive. One is to become humble in the name of learning. So we're more interested in curiosity and learning from one another. Be open to new ideas. Give everyone a chance to speak. We'll want to make sure we get our panelists information, but we'll also want to open it up for questions from all of you. Maybe you have things that we can think about together. Attack the problem, not the person. We might have areas of disagreement, and so it's helpful to speak to those areas rather than attacking anyone as an individual. Respect the confidentiality of the personal views and stories shared. If anyone shares something private, then we'll just want to make sure that you all do know that this is being live streamed and it is available. It will be available on public access. So don't share anything that you wouldn't like to have available through those means. Our Level Up Council at YWCA Northeast Indiana puts on these events because we believe our community can only truly prosper when each member is accepted, supported, and valued. So we want to take deliberate action to educate, empower, and unite people through our programs to create inclusion and build racial equity. It's our vision to help our region become the equitable place we know it can be. It's time to level up. So I want to turn and introduce our panelists. We're very excited to have Antoinette Francher-Donald here. She's the director of the Children's Health Collaborative. And there's some wonderful information about how she's participated in the Community Foundation. It's an initiative of the Community Foundation, and they have worked on strategic initiatives to build 9 healthy habits, academic enrichment and support for K through 12 students, and working with organizations that provide well child exams. But when I spoke with Antoinette, she told me a lot of things they were working on, so I'm very excited for you to hear more soon. We have Aisha Arrington here, President and CEO of the Fort Wayne Urban League. She's worked for over 20 years in local nonprofits, including Healthier Moms and Babies, in-home services, being the executive director of the LTC Ombudsman Program. And so we're thrilled to have her here joining us today. And we have Antoinette Johnson, Assistant Director of the Allen County Bowen Center Health Clinic. She serves at the Bowen Center Health Clinic, which has an integrated healthcare model. And some of our staff were lucky enough to get to take a tour of the clinic there in the Rudisill Plaza and see some of the outreach they're doing for the community. So we're thrilled to have her today as well. And I'm Carla. I'm the Director of Mission Advancement at the YWCA, and I'm just here to ask questions so that we can hear from our local experts. Some things that I do want to announce, though, before we dive into the panel. YWCA is putting on our second annual Race Against Racism 5K Walk Run. So when you hear 5K, if you're not a runner, you may be a little intimidated, but this is a walk or a run. And as we think about health and opportunities to build health and wellness, walking or running together towards the goal of eliminating racism is something hopefully that we can all enjoy. And we're going to have a lot of local groups there to share the word about what they're doing. We also have a Couch to 5K guide. So if you haven't been walking much and you want to get into it, you can follow that guide for ideas. We are also hiring for a racial justice coordinator. You or someone you know may be looking for a job opportunity where you could spend your full-time work engaging in the work of building racial justice in our community. So I wanted to highlight that position, as well as we do have other positions available for a bilingual Spanish advocate and other opportunities, which you can find on our website. The rest of this year, we'll have dialogues on housing and race, criminalization and race, and in November, one for thankfulness and diversity, looking at how we can appreciate the different kinds of diversity we have in our community. And you can always donate, which is also available on our website. So, with no further ado, I want to get to our panelists and ask our first question of the day, which is to ask you to tell us a little bit about what you have learned and observed through your work about health disparities that are related to race and ethnicity in our local community. So let's go ahead and start with Antoinette at the far end, Antoinette Francher-Donald.
Well, thank you, Carla. I just want to also say thank you to some wonderful people in the audience. I have 2 interns here today, and CHC does what it does because of them. So if you guys would please raise your hand, Alexis and Angelica. So I'd like to start by sharing, last week I attended an Undoing Racism training. It was 3 days. I am taking part in a 18-month training with the Greater Fort Wayne YMCA, and I heard a quote that will stick with me for life, and this has so much meaning to it, and I hope we all can take it away. It was, "No history, N-O, no self, N-O, self. No history, K-N-O, no self, K-N-O, self." That was an incredibly powerful a quote from one of the facilitators, and I want to say I want to bring it into today because every day I gain a new piece of information about disparities. It's disheartening, but some of it is to fix some of the issues. The way our system is set up, we do not, as African Americans and BIPOC, know about ourselves. Our history has been hidden, and we have been taught to not talk about it. Now we're being told, do not share what truly is happening. So it's hard to advocate for ourselves if we do not know what has happened to us. Epigenetics, which is a newer science, knows that trauma is carried down through our genes. So what has happened to us, our ancestors, 400 years, is coming to us, and we know that trauma does create acute and chronic disease in the body. So I just want to start by saying that. How do I know? Because nearly 50% of adults in the Black or brown in the United States are obese or overweight, compared to 40% of white people. A white woman is 3 times less likely to die during childbirth. A newborn or an infant is more than 2 times likely to die by his or her or their first birthday. And so we also know that the tobacco industry does a lot of marketing within Black and brown neighborhoods. There are different figures, numbers depending on the state, but we know that it's so heavily marketed that 78% to 93% of African Americans smoke menthol cigarettes. So how do I know? I know disparities because of the numbers.
Thank you. Yes. Let's turn to Aisha to
Sure.
answer the same question.
Thank you, Antoinette, for sharing such a good insight into what we're talking about today. One thing that's interesting with the Urban League, nationally, there's the State of Black America's report that is printed every year. And for 2022, that report illustrated that African American people receive 73.9% of what white Americans receive in areas of health, social justice, wealth, and income. And so while 73.9% seems, not too bad, we're still falling behind. And that includes, just access to health care. COVID kind of put it right in front of our face. There's no way not to look at that data and not understand how African American people, brown people were tremendously affected by COVID, how we died at way higher numbers, how it affected our communities in so many ways. First, we are those workers that couldn't stay home. And so we were exposed more. There was so much bad information that was put out for COVID, and we didn't do a good job at jumping on it quick enough so that we could educate our Black and brown people about what COVID really looked like and why we needed to get that vaccine. And we're still suffering. The Urban League was able to partner with Health Visions here this past December, and we were able to connect with over 300 Care Source clients here in Allen County, where we were knocking on their doors and giving them door knockers that just illustrated some myths about COVID and where they could get the vaccine. And I'll tell you, just doing that boots on the ground work, some of that bad storytelling is still out there in our community. And I remember one woman that we spoke to, we were standing on her porch with our door knocker in hand. She had lost her mother and her brother to COVID and still refused to get the vaccine. She didn't trust the vaccine and just didn't want to get it. And see, those kinds of things are hurting our community. How do I know that disparities are there without looking at reports? Because the Urban League remains that boots on the ground, and we're working with our community members, and we hear it every day. I live in the 06. I have to shop at Kroger at Georgetown to really get to a good grocery store that's fairly close to me. I can go to a liquor store. I can go to a food mart, but there's no grocery store. And so I know we're talking about bringing that grocery store on the southeast side, but I live that every day. If we run out of eggs, God forbid you run out of eggs nowadays, I've got a pretty good truck to get to somewhere to access that. And that's just not me personally, Aisha, that's the community in which we live. I think Antoinette shared some really good statistics at just how even now in 2023, African American women are more likely to die in childbirth than any other woman. I mean, wrap your mind around that, 2023. And so what those disparities really look like is that there's a lot of work to do. When I started with the Urban League, disparity is really a popular word that we kind of throw around a lot. And I looked it up, just what are we talking about when we say disparity? And really what we're saying is that there is a significant difference. So there's a significant difference between African American women, brown women, and the health care they receive and what white women receive. And so just think about that. That's what really we're talking about when we're talking about disparity. We're seeing it every day in our community. And when we have forums like this, I just think it's important that we're honest about where we're at, and I can tell you in my own community, there are women that have come through the Urban League that have no health care still. They are pregnant and have still no access to health care. They have no transportation to get to different places. And even when we work with them and they get on Medicaid, not every doctor accepts Medicaid. That's kind of the elephant in the room, right? We think everyone has access to a doctor of their choosing. And to me, that's so important when we talk about disparity, because having good health care means you have really good communication with your healthcare providers. And without it, that means you're not getting good care. There's no way to build a foundation to get good care. And so I think when we talk about disparity, we've got to talk about how are we moving that needle to build really strong relationships between our healthcare systems and our Black and brown communities.
Aisha, if you don't mind, I'll add that white America is much more likely to have private insurance, which is favored by our healthcare industry. And so when we have private insurance, we tend to get better care.
Yeah, I think that's such a good point, Antoinette. And also, I don't know if it's a good place to say it here because it might come up later, but I've got to say it now because it's on my mind. As African American women, we have a lot of us, not all, because we all are unique and have our own stories, have lived by that strong Black woman motto, right? But it hasn't always served us well, especially when it comes to health care. Because when we get in front of a doctor, a lot of times we're not heard. And this may be TMI, so excuse me, but I do want to share this and just be candid about what we're talking about here. I, about 8 years ago, had an 8-pound fibroid tumor removed, so it was a big surgery. And because they found that tumor, they also found 2 spots on my pancreas that was cancerous. But prior to that, ending up in the emergency room and having them do a full body scan to find that 8-pound fibroid tumor, I had gone to the doctor 3 times. Now, I'm a working mom, professional, right? So I'm trying not to take a whole lot of time off of work, but I kept telling my doctor, I feel this pressure and it's not going away. And I was always sent away, you know, with medicine or whatever, and that you've got fibroids, it's popular in African-American women, you'll be, you know, just kind of deal with it, really. You're too young for a hysterectomy. And when I had that surgery, now I've got a scar from here all the way down. It reminds me every morning of how I was not heard. I kept saying there's pressure, I feel it, it's hard. But I couldn't get the health care I needed sooner, and that thing just kept growing until it was 8 pounds. I know that's not unique to me. I know there's other African-American women, maybe in this room or listening to this panel, that have had similar experiences, and that's why I'm so passionate about relationships, and that starts with trust. I've got to know that if I go to a doctor, that 1, they're listening to me, and 2, they're trying to help me get the best health care that I can possibly get.
Thank you for telling the personal story. I think, it's one thing to think about the theory and how it is in society. It's another to think about how is it right here. And I know when you named about the maternal death disparities, Fort Wayne has one of the high, some of our zip codes have some of the highest rates in
We are worse than
in the
developing
state.
countries.
So
Allen County.
those are things that make it kind of hit home how these things are right here with us. Antoinette, I want to ask you the same question. How have you learned or observed about health disparities relating to race and ethnicity in our area?
Working at the Bowen Health Clinic, right at the Rudisill building, we were intentional about having that location there because that is right there in the heart of the underserved, vulnerable populations. So every day I go to work, I see patients that come in that I can directly relate to. I am an African-American woman that have went through disparities. So I see that trauma when they walk in the door. I see that fear. It's like an onion where you got to peel all that back. Even though we want to build that trust, it's hard to get to that trust because, like these lovely ladies were stating, they have went to several doctors where they felt like they wasn't heard, or better yet, it was a terminology being used that they did not understand. Even so more when you even dig a little deeper than that, even when it comes to pain, we have so many come in the office of pain and they feel like, well, my doctor didn't give me pain because automatically they felt like I was going to abuse it. So I had to go to pain. I got to go to a pain management doctor. I had to find other avenues to dig into deeply. So being at the Bowen Health Clinic, I'm able to see it hands-on, especially with COVID-19. Even with my own grandmother, when she was away, we couldn't go to the hospitals, and she went to the hospital with COVID. So the first thing didn't come to my first prayer, because I'm a religious person, but the first thing I thought was, wow, my grandma's an elderly lady with Medicare. She's not going to return home. You know, so is she getting that proper care there? Is she getting that proper treatment that she deserves? Even though she did pass away, but you can't help but to think those. Me being an African-American lady with a chronic illness, like she was saying, or going to have my child, the first thing you think is, wow, is my insurance good enough to get this proper treatment? Or am I going to be just treated like a number? If it's time for a life-saving mechanism, will I get that life-saving treatment because of the color of my skin? So I am with pleasure to be working at the Bowen Health Clinic right there in the heart of it and seeing it every day to show that, hey, you deserve the same proper health treatment. You deserve to be a part of your care. You deserve to be into your care and understand your care and advocate for what you need, and you deserve to be heard, because at the end of the day, we still work for you.
We are going to invite some audience participation, but I feel like what Antoinette said does lead us right into our next question, so I want to build on that a little bit. What are some of the ways that you and your organization do work at trying to build opportunities for people who have been underserved or haven't had access to positive health care and supports, so that things can start to get better and they can be engaged in good health and good care? Do you want to start, since you were
Sure.
talking about what you're doing?
Sure. We are very intentional about our patient needs. So we know that they might come in with Medicaid or might not have insurance at all. So making sure that we have a way to get them connected. Good thing we are in a Rudisill location. We can take them right up to the upper third level to get the Medicare insurance. We are intentional about meeting with drug reps that would give us samples with the illnesses that our patients have. So they are able to get that medication for free. It's just going over and beyond, knowing that patient personally when they walk through the door. If they anxious or have depression, we know that, and we can put them in an environment that's comfortable to them. So doing community events as well that target wellness checks, giving child wellness check events, vaccination events, different type of events, get mammogram events, different free resources that be intentional about giving that health care that they deserve. Just being really hands-on and knowing what is it that they need, even if it's resources of food, shelter, transportation, getting bus passes, gift cards to get food. We are very intentional about the needs, because if we don't take care of those everyday living needs, then they're not going to even pay attention to what we're trying to do with the health. They need somebody to intentionally walk aside them. Even if our patients have such a chronic diagnosis of cancer, normally it's like, okay, go see the specialist. We are intentional about having a therapist go and walk that walk with them, have that journey with them, get them connected to the resources in the community, but also follow up to see that they did receive that treatment. So we are very intentional about giving systematically equality health care. We're very intentional about it.
Thanks, Antoinette. Aisha, I want to ask you the same thing. What are some ways that you named one already with the COVID response,
Yeah.
but that you have worked at building up health opportunities?
I really like Antoinette's word of intentional, because I think to move that needle to, good health care for all people, it has to be intentional, right? And so with the Urban League, we don't have any specific healthcare programming going on now, but what we're working on is really developing relationships in the community so that when our urban leaguers call us, we can give proper referrals and that we can kind of guide them into the right direction. Right now, the Urban League has a partnership with Notre Dame, and we're running a Happy Families program where we're offering families coaching to try to talk to them about different issues that they may have in the family. And it's kind of just a leaning into possibly getting mental health services, because as we know, African American populations are less likely to get mental health treatment for a variety of reasons. But what we've seen with the coaching is it kind of opens that door a little bit for families to start understanding that maybe they would benefit from counseling, maybe it would be okay to get some mental health services within the home. So we're hoping that that grows and opens that door more. I tell you, because we're in the heart of the southeast side, as Antoinette was saying, we're right there on Hannah Street. We never know what's going to walk through our door, what situation is going to come to us. And right now we've got a homeless pregnant woman that we're working with to try to connect her with services. We find her sleep at our front door mornings. You talk about, well, just get her in a shelter. It's easier said than done. She has a boyfriend that's homeless too, and he doesn't want to abide by the curfew rules of the shelter, and they don't want to be separated. So they've kind of honed down together that they're going to, find a place together. But anyway, we're trying to make sure that she gets the services that she needs for her and her baby. But it really goes back to those relationships, because you can't offer help and service without there being trust there. And so the first thing that someone thinks maybe in her situation is she's Black, she's pregnant, she's homeless, she's poor, that there's going to be, a case made against her, that her baby will be taken away. And so sometimes it sounds easy to just offer help, but there's so many barriers that we have to consider when we're offering someone help, that they understand that they can trust us and that we're on their side. So we're definitely doing that, and hopefully, we're able to align her with services so that she and the baby can be healthy. We talked about the COVID and our partnership with Health Visions. We're working with area churches that have clinics for those boosters and the immunizations, and we're talking about that, making sure that we're just at the table, that the Urban League is even here today at the table, sharing our story and knowing that this is something that we want to concentrate on. But not only that, just educate the public about, when we talk about health disparities and race, what does that really look like? So thank you for even having us today.
Thank you, Aisha. Antoinette?
Carla, I just want to say I've never heard my name so much in one day. I'm like, so which one is she talking about right now? So, Children's Health Collaborative is really an initiative that started with Dr. Deb McMahon, our former health commissioner of 20 years. She had a vision that no child, or all children, should be able to physically, mentally, spiritually, and educationally live to their highest potential. So I'm sitting in her seat right now, so I just want to thank her for that. But CHC has 3 strategic activities that I work on daily with community partners, and my community partners range from everywhere from Yule A. Wilson Center to Parkview to Bowen or whomever, Allen County System of Care. So really working with community partners to deliver those initiatives, and I'll share one. Some of you, when you came in, you may have received what's called a wellness tracker and a bookmark. Some of the folks in the room are very familiar with it because I know some people who have been out there with me, but I am working with the FWCS, East Allen County Schools, as well as youth centers to promote the 9 healthy habits. We know that each healthy habit that we embody, we're more likely to have healthier outcomes. And so that being said, working with our most vulnerable and marginalized populations, we scale it to what they can do. Because when you have a single mom, 3 kids who live in poverty, sometimes getting our children 7 breakfasts a week may not be possible. So they may need to eat the innutritious food at school for breakfast. That's another initiative I'm working on, because our kids deserve better in the morning. Our kids should not be starting their days with sugar. It's absolutely horrific. So actually just working with the centers, what they do is there's curriculum built around it. And each month they work on a healthy habit with the kid. So they repeat. The participant, whether it's an adult or youth, what they do is lots of times, for instance, 0 sugary drinks. They'll take that healthy habit and they'll work on it with the kids. Like, how can we reduce our sugary drinks? Sugar tastes good, it's addicting, but it creates a lot of disease and it's inflammatory in our bodies. So when we get too much, it's like, ooh. So really telling the kids what's happening in their bodies with it and what they could do in place of starting without a Mountain Dew in the morning. Starting with perhaps skim milk or water, which is better. And lots of times people may not realize, but fruit juices our body thinks it's a sugar and it reads it like a sugar. So really understanding, if I want that, how about doing half and half water, half juice? So just really educating the kids on practices that they can incorporate into their day-to-day life. I like to say, to be the best me, I need all 8 of these. And Carla, I share with everybody, every one of us needs these, not just kids. And so just really teaching the kids how to stack them, talking to the kids about what they already do well. I think one of the healthy habits that's really critical right now is the 4 positive self-messages a day. I'm really concerned about the mental health of our kids. Data right now, young black men, the fastest growing group for suicide. We have national data that young black children 12 and younger are twice as likely to die by suicide than white children. I said 12 and younger. That's really sad, isn't it? So the mental health of our children is suffering. But when we have healthy habits built in, we're more likely to be resilient. So I like to say I'm really good at the sugary drinks and the hour of activity. I say a whole bunch of positive messages about myself if y'all can't tell, but I do. And I'm getting better. I used to struggle with the 8 hours of sleep, but I'm liking my sleep, and I'm learning to turn off the devices, and just showing kids ways that we can incorporate these, and each time when we stack one, we're likely to be more healthy. And the reason I like the physical hard copy tracker, because we do too much on our phones. And so it's a dry erase board, so I encourage everyone in here to take this with you and start with one healthy habit. It could be walking 5 minutes a day, 10 minutes a day. Take one habit and just work on that for a while and see how you can start building them into your life, because healthy habits mean healthier health outcomes. So that is one of my biggest initiatives. I'd be happy to share more about that. I'm also working with Colleen Carpenter with Northeast Indiana Stop Suicide. We are working to garner a grant from the state of Indiana to create a campaign awareness around Black suicide, because I'm okay with telling my age. I'm 55, so I know I look good, thank you. And so when I grew up, we didn't talk about suicide. Black people, we didn't talk about suicide. It was very secretive. And we know sometimes today it's a very difficult issue, but we know our Black youth are struggling. And how do we reach the community get the tools, and ask families and churches, Black churches, what do you need to share this message, because we know it is happening. So working on that. I also have an initiative working with community partners. 45% of youth pre-COVID had not received an annual wellness exam, which is very critical to their development. Indiana is known for their delay in really diagnosing, whether it's a physical or some other type of disease. And so really working with community partners at bringing physicians and mid-care level folks to families, because the families do not have the transportation, and even if they do, it's a distrusted medical system because of, I can just say I'm sure some of the older people would understand Tuskegee. We've had a lot of history of maltreatment in the system, and so we don't have a reason to trust. I have a personal story. A lot of people know I'm an avid runner, and 4 years ago I fell when I was running and I tore my the cartilage in my left knee. I as well was told by a white doctor, just stop running, you're okay, it'll be okay. And I said, what? I'm 51 at this time, like I have so much more life. And so just really advocating and bringing services to the families, because lots of times we also have parents, they're working. They don't have the capacity to go to a medical facility between 8 and 4. So working on that initiative. I'm also working with FWCS now. We're trying to potentially bring annual wellness exams to, we'll say, a off-site setting periodically so our students can get what they need. And I'm working with other organizations such as the police department and the fire department. We have mentorships, so they go in once a month or twice a month, and the after-school programs, working with students, just teaching them healthy habits as well as playing with them, reading with them, because we know our ability to read affects our outcome of our health and health access and health equity. So working with Purdue Fort Wayne on some projects, as well as IU Fort Wayne School of Health and Human Sciences. Big shout out on April 13th, mark your calendars. The IU Fort Wayne schools, along with CHC and 30 plus other community partners, we will be having a health fair at Ren Point Y from 4 to 7. We will be giving away a ton of giveaways and resources around health.
Wonderful. I do want to give the opportunity now for community participation. So we will have some more questions for our panelists as well. But in the meantime, are there people who have pressing questions or thoughts or things that you wanted to contribute to the discussion? I see people from a lot of different places around the community out here, so we would love to hear from you. Aisha has a microphone that she'll be glad to bring you. Now Aisha's hearing her name as well. So Aisha Pearson has a microphone that she'll bring around, and we'll be glad to take questions or comments to add to the discussion, or if you have a question for a specific panelist, you can say so as well.
So this question is to Aisha. In your previous role, which is when we first met, my father's in the nursing home, and my father's white, and the majority of his providers, healthcare providers, are people of color. I see disparities through an educated white woman's eyes, right? What could you tell me about the health disparities you've seen when you worked in elder care?
That's a good question, Melissa. And I'd have to say that I was executive director of the LTC Ombudsman Program for 14 years. We were the largest ombudsman area in the state of Indiana. I had 9 counties, 91 plus nursing homes that I was over. And it was really COVID that burned me out to make me think I need to find another gig because this is, really rough. And so during that time, we know that there are disparities and we know there's discrimination. Part of this dialogue today is talking about race. And we know that Black people on Medicaid that go into nursing homes go into some of the poorest nursing homes there are. And what does that mean? Then they receive less care than someone who goes into a nursing home that isn't predominantly Medicaid. And there's a handful of them. So I told you we had 91 plus facilities. Here in Allen County, there's probably about 15 or 20 that are redlined, meaning those would be the nursing homes that we heard most from the Ombudsman program, because no one called us to say it was all rainbows and bunnies. We only received calls from families and those living in the nursing home when there was a problem. And so there was about 15 or 20 of those. And when I'd head out to those nursing homes, about 70% of that nursing home would be African American. And so when we did our advocacy work, a lot of times it was for someone elderly, Black, on Medicaid, not receiving really good care, but it was an uphill battle to try to get that good care. I mean, there's so many stories I could tell you in my 14 years of service of what that really looked like. I remember visiting one woman, and when you walked on the floor, it was just sticky, each step sticky. Oh. And that's how much crud had built up around her bed, and she wasn't mobile, so she depended on, help to and from the bathroom. And so I went and I said, listen, can we at least mop the floor? I mean, it smells, she had flies in the room, and we'll get it clean. And I went back that very night to see if they had mopped the floor, and they didn't. And I got a mop bucket and some Fabuloso, and I said, we are getting this doggone floor cleaned up. And they were looking at me like a crazy woman, like, oh, what are we gonna do? And but the floor got cleaned, but it was just that, how would you feel in healthcare? Imagine yourself in a hospital, laying in a bed that needed clean sheets with a nasty floor, and that's where you're going to receive your healthcare from. So it's a huge problem. I don't really see it going away because if you don't have private insurance and you can't pay private pay for that home care stay, it really doesn't look too good, you know. And let me say this too. A lot of times people think it's bad planning, right? Well, poor people just don't plan well. They're not saving their money. They're, you know, what have you. First of all, there's no money to save.
100%.
Let me tell you that. And two, even if you were to save, to pay for nursing home care for a year can be up to $70,000. So unless you're rich and you have really good private insurance, you're not going to last very long when it comes to 24-hour, you know, nursing care. And I will tell you a little joke that I had with my daughter. She's 14 now. But she had asked a couple years ago for some really expensive jeans. They were like $160, and I was like, college fund. And then that became my go-to. So if she'd ask me for something expensive, I'd say college fund. Doesn't that sound smart? So one day I had made her mad about something, and she said, nursing home. And I was like, you know what? It taught me to stay in line. But anyway, it's a big problem. And what it is, what we're seeing is, you know, a lot of times where we're born is out of our hands, right? So if you're born in a poor zip code that says you have a life expectancy of 70, that might be about mine. I'm in the 06. Somebody correct me if I'm wrong. So I don't have, you know, a whole lot of time. Well, that's really determining what kind of health care I'm going to receive or didn't receive, and pushing me into nursing home earlier than someone else if I can't figure out how to get really good health care now and figure out how to take really good care of myself now. And I think Antoinette, sorry you're hearing your name again, brought up some really good points of self-advocating for herself with health care so that she could model that at home. I'm leaning into that because, I haven't taken really good care of myself. I think there's a lot of black women, professional black women, raising children and doing the whole professional gig and not taking good care of themselves. And we're not allowed to say it. We're not allowed to say it's too much. We're not allowed to say we're stressed the heck out because we have to perform. And not only do we have to perform better than our white counterparts.
Try
or
3
we're not
times.
here.
Try
Yes.
3 times, sister. 3 times
Yes.
better.
And that stress that we carry, part of the reason why I could carry that 8-pound fibroid for so many years was because I had to do it. I felt like I had to do it. Even for me to sit in front of you today as CEO and president of the Fort Wayne Urban League, and I'm so proud to be a part of that organization, but I got to this point by ignoring a lot of my own personal needs, and that's got to stop. So what I'm trying to work on, and I'm not perfect, but I'm trying to be like Antoinette, trying to show my 14-year-old some good, healthy habits, and that as black women, our health care matters too.
If I could just add, the zip code you live in compared to a boy is a 20-year life expectancy difference. That is unacceptable.
Yeah.
This is not data I'm making up. This is data that was recently posted. And so I encourage people to know more. And advocacy can be difficult. It can be very challenging because, especially if you're raised to think that that the medical profession is correct and they know everything, but we all know that our medical system is racist and biased. So they've already have preconceived notions about when you walk in. Do not be scared to say, let's back this up, because if not, I've seen people die because of it, and no more. So if you can't do it for yourself, call Antoinette. I'll talk to the doctor. Yeah, it's sad because we have been taught to believe, and I want to honor the medical profession. I'm not in it for a reason, but I also want to honor that they are humans, and the bias is that black women can continue to feel pain, and we don't feel the same pain. That's very untrue. We've just dealt with it for so long, and it's taken a toll on our health. It will make you ill. It will make you physically ill and die sooner.
I think we have another question there.
Hi, we have a question in our live chat on YouTube. If we believe that we're a victim of inadequate health care, what are the first steps that we should take, or even to be advocates for other people's health care?
I think Antoinette really laid it out with some tips about learning how to be a good advocate for yourself. And if you're in a relationship with a doctor or a healthcare provider and it doesn't feel right, change. They're not the only doctor. So if you're not having a good experience, advocate for yourself and start researching another doctor and other opportunities, someone that you can get in front of to get the health care that you need. And then I would say, victim is a harsh word, but I think even more so, release the shame. There's shame when it comes to race and healthcare, and it's created by the system. You know, when I was on welfare as a young mom, I received food stamps and welfare benefits, and I had to sign a paper that I would not get pregnant again within a certain amount of time, or my benefits would be cut off. Okay, so my daughter was born in '95. That wasn't that long ago that my oldest baby was born. And I had to sign that paper. How do you think that made me feel?
That's
There's so much
disgusting.
shame. So when I got pregnant again, 7.5 years later, I was shamed to go to the doctor still unmarried. And now here I'm gonna have another baby and I'm gonna go in front of another doctor. By then, I was off of all my benefits. I was working 2 jobs and I was shamed to go to the doctor to say, here I am pregnant, I have a baby, I'm unmarried, but I had health insurance, I worked a full-time job, a part-time job, but that shame never went away.
I believe part of that advocacy, I agree 100% with what you just said. I think part of that advocacy is calling that doctor out, talking to them, have them explain it to you at a level that you understand. And if it don't work, feel okay to find something that does work for you and your family. But I think taking away that fear, like she said, victim is a strong word to describe it, but knowing that you have those same rights as everybody else. So being able to stand up for your rights, and regardless of what that insurance is, you're still paying that provider. So they still work for you, and just having that strength and finding that strength and know that it's okay. I think the stigma and the barriers have made individuals lose their confidence. So finding that confidence, that self-esteem to be able to advocate is the way for you to advocate for yourself and others, and join teams like we're doing here today to bring awareness to it, to talk about it, so that we all can stand together and be that change that we want to see.
I would also say within healthcare systems, this is not a perfect science, but there are advocates for patients. Also contact a patient advocate. They do have them, and so sometimes they can help with the language. But I would say, you know, this is a harsh word, but demand that the care provider is talking in your language. Explain this to me, and could you explain why you've made this decision? And if it's something that crosses your value, your moral system, and just is racist, don't accept it. Say absolutely not.
And report it.
Yeah, report it. Call it what it is. Call it. Don't. I think I don't think we've been socialized to not call something what it is. And if it's racist, it's racist. If it's sexist, it's sexist. Call it what it is, because we keep the power and the privilege in place if we don't. They have nothing to think about if we don't ever call to it.
We have another question over here.
Sorry, I had a
Oh, we'll get to you momentarily. Okay.
I had a question. I work with sexual violence survivors, and a big portion of those survivors are Black and brown women who are over-sexualized, and they experience that in medical settings too. And so I try to work with them when you go in, having to advocate for yourself and saying that there are ways you're not comfortable being touched right now, or sharing your experience. And I really have some survivors who struggle with that, because then they fear that they will be seen as that aggressive Black woman and not believed for their story. So I guess my question for you is, when they're in those settings, how do they verbalize their needs while not playing? They're so scared that they're going to be stereotyped that they don't want to speak up and say the things that they need to, because it's a very complex trauma. So what are your suggestions on how to approach those conversations with medical professionals?
Did you want to go?
That's such a hard question. Gosh. my heart goes out to those situations because I totally understand how that feels. I know how African American women have been overly sexualized. You know, I grew up in the era of Two Live Crew, you know, I mean, it doesn't get more sexualized than that. And again, there's some shame that we carry with that. And I think the more that we tell our stories, we empower other women to share their story. And so what I would say for those women is really do your research and find some voices of women that have gone through similar things, because then you learn the correct language and you understand that you're not the only one. And sometimes it starts with that. And now that's so easy with Google and social media and all of that. There's a lot of negativity in that, but there's a lot of good, you know. And so just reading about other people's women's stories, hearing their voices, learning about different situations that they went through, and then sharing your own story helps us empower, you know, folks. But I think just as a culture, we've got to do better. You know, we've got to do better about retelling what that story should be, how it should read, how Black women should be perceived in media and social content, because it's still a problem. You know, it still hasn't gone away. And so it's either we're a mad Black woman or, you know, we're Aunt Jemima. I mean, we just, there's not too many places we can really go, you know. And the more educated that we are and the more educated we speak, the more that we become difficult, right?
Yes.
And so that's part of it. I'm sorry, but that's part of what we're dealing with here. And the only way to break through that is to really learn ways to self-advocate, and it's a journey. So maybe when they're meeting with you right after that trauma, they don't have the language, they're not necessarily know what to do, but I would just pour myself into research to really learn about how I'm not the only one that has suffered in this way, and how can I connect with help and other women in my community that can identify with what I've gone through, so my story and their story together becomes more powerful.
Thanks, Aisha. And I would just like to add, I would encourage maybe the female survivor to, if there's someone who has gone along that journey that has a voice who can speak, to take that person along with her, and preferably a woman of color, because that woman of color who is still on that journey to healing, who will never completely heal, can speak voice for her at that time if she's still vulnerable. And so I think that's also helpful, especially if that the friend or partner or whomever it is able to decode what the system is saying.
Decode, that's a good word, yeah.
Thank you. We have another question or comment here.
Yes, I was listening to you make the comparison between the 06 community and someone that's living in what you said?
Boyd Township.
Boyd Township.
Yep, Southwest.
Is that the same if the African American living in that area?
I can't answer that specifically, but what I will say is the African American still living in a Boyd is still more likely to die earlier than the white person because of their racism in our system.
And then you said there was about a 20-year gap.
There's a 20-year gap.
Anybody here live in the Boyd area? Raise a hand. Okay. I'm 06, so you guys are probably going to leave about 20 years longer than me, maybe.
I don't think so.
Yeah, those averages are shocking.
Very sad. And see, this is why formats like this we need to have more often, because it's about our community knowing the data. Knowing the data. Data is powerful.
Did I see? Oh, yes, there.
I have a question/comment. So much of what we talk about is about advocacy, and I think that's important that we advocate for ourselves, but also at some point we have to demand some system change, because white supremacy is harming us all, and it's kind of the root of what all of this is. So I'm just wondering, you know, at what point and how do we shift the levers that are keeping all of this in place and all the disparities in place, and how do we make some policy change within hospital systems, and how do we, you know, demand that doctors are trained in a way that does address their implicit bias, and if they can't deal with that, then maybe they shouldn't be in that field if they can't do better by their patients. So I do think it's important that we advocate for ourselves, but I also think it's important to not let the systems off the hook so much and demand that they do better and us be strategic in ways, and I don't know if it's in who we vote for or who we put in positions to change policies within these large organizations. So just kind of something else to put on the table.
No, I think you're so right about the advocacy and then just having systematic ways to solve it. Does anything come to mind when you think of that, of something concrete that we could do to move that needle a little? I struggle with that because you're right. It's holding people accountable for really bad care and really bad communication, and we're putting all the pressure on the individual to advocate, but then we're not demanding for just better service, equal service.
I would like to add, we need co-conspirators in our white brothers and sisters who have all the power and at the top of these systems. They need to speak truth in their systems. And we need that to make this happen because Black and brown people are more than likely, even if they're in a position of power, are unlikely to be able to make changes because they're the only one. And so to be real about it, it's really damn hard sometimes. My husband is usually the only Black at the top, and so is Antoinette. So it can be really hard. I'm sure as a sister, you know, I go to work some days and I'm carrying everything on my shoulders. And I have to keep it together because I have been labeled as the angry Black woman. And so we need for our white brothers and sisters to be co-conspirators and talk to other white people about their racism. And like you said, call it white supremacy, call it white dominance, call it racism, call it out, and say, hey, how are we gonna fix this system? And because we keep on asking the marginalized and vulnerable people to carry the weight. You as Black people, what are we gonna say? I can't say anymore, I'm tired. I'm tired, girl, I'm tired, you know? So we've got to stop blaming, I don't mean, but generally speaking, asking our Black and brown people to keep lifting and doing the heavy work.
And it's not just the healthcare system, it's where we work. You know, our workforce, you know, is held up by Black and brown people, and those very people can't even ask for time off of work to go to the doctor. You know, let's call that out. So we have all these non-for-profits in this area. We've got all these businesses that say they're all about diversity and inclusion. But then if someone Black or brown comes and says, you know, I'm going to be late tomorrow morning because I've got to get into the doctor, there's a big problem. You know, we've got to address that too and call that out. You know, I raised that because I was just talking to a girlfriend yesterday that's been suffering with migraines. And every time she tries to get into the doctor and schedule it with her boss, she always has to push it back because something else comes in front. And I'm like, no, you call in sick tomorrow. Just don't even go in. You've got to get this checked out. It could be something more serious.
Seems like sometimes I've heard some people say, by having a Black doctor, and especially she's a Black female doctor, they have a tendency to understand us better, how we process food because of the disparities and so forth. They know what to look for. Even when you say you got an ouch here, they know there's also an ouch somewhere else too, and just to look for whatever else. Do you think it makes a difference when the person goes to an African American?
I'm just going to repeat the question so anybody listening online will hear. The question was, would it help for Black people to go to doctors who are also Black, especially Black women doctors, and would that help to make sure that the doctor clearly understands the issues that the person might be dealing with? So
Antoinette might have information. I haven't seen any data that specifically supports that idea. What I do see that data supports is that if there's a history between that individual and their doctor, they're better able to get better care because they've then built a relationship and that person has been following them for years. And we've gotten away from that. Just that family doctor that knows the whole family and knows kind of the history, that can help.
I don't have any data on that, but what I will say, what I've seen in my practice is that when we, as Black women, see a Black female doctor, we feel more comfortable sharing what is going on with our bodies. So we are more likely to receive the treatment, and the Black female doctor is going to more than likely believe us and not second guess what we are saying. So, more likely we will have that better health outcome. One of the issues in Fort Wayne is we have very few Black female or Black doctors because of the system and the way the system has been set up. I have a friend who recently left one of the healthcare systems to move and go on somewhere else as a Black prestigious doctor because of the racism in the system, and she continued to get pummeled every day she went to work. So it leaves we as Black women fewer and fewer choices to have Black providers. So it makes it a lot more difficult. But yeah, anecdotally, I don't have the specific data in front of me. We're more than likely to feel more comfortable with a Black provider.
You, as the audience, have been very perceptive and asked a lot of good questions about. If you have one now, please feel free to add.
I'm actually just wanted to respond to both of y'all. I'm a midwife in the system, and I moved here from Philadelphia 3.5 years ago, and I'm still having culture shock. I originally moved here about 5 minutes from here, working up in Auburn. I just 3 months ago started working at Randalia because of my connection with the Black community in Southeast Fort Wayne. I mentor teen moms and also have been part of training Black doulas. And yes, there is data that supports Black women going to Black providers, which is why I came to work for the practice that I'm in now in Randalia, because we have the one Black midwife in all of this part of Indiana. And she's quitting.
Yeah.
We have lost so many Black doctors here in Fort Wayne because of the racism that they're experiencing and that they're seeing on a day-to-day basis, particularly women. Within 3 months of being at Parkview Randalia, because of the things that I've seen, I went to the Director of Equity and Inclusion and I spoke with him about what I was seeing, and he wasn't surprised. And then he started sharing stories with me about what he's been seeing. And I said, okay, what are we going to do about it? He said, well, we could fire people, but it's the heart. How are we going to change the heart? Well, that just shows me that he's in a position just to say that there's a position for that.
Yeah.
And that there really isn't anything being done about it.
Right.
And so I'm okay with being the angry white woman. And I will continually be the angry white woman.
Our white sister.
And I want to take care of this woman who's been coming to your door at the Urban League. Like, there should be a safe place for these women to come to. And it's breaking my heart on a day-to-day basis, the things that I see here in Fort Wayne. And whatever I can do as a person who's in the system, I want to do it. So feel free to reach out to me in any way.
I was going to add, how do I know there's disparities? Angelica, my intern, looked to find a Black dietitian. There's not one to be found in this area. Have to go to Indianapolis. That's unacceptable, right?
The one I know just retired from Parkview.
So just a really quick comment. The young woman was talking about, what can we do to make systemic changes? One of the things that we need to do as Black folks is vote.
Amen. Amen.
There's an election coming up this year, and so be familiar with folks who are running, and there are some white allies who are running, so vote.
Girl, Black women have been saving this country for years. Just saying.
I think I see people who are running for office in this room, and
Yeah.
I have to say, it is important. I mean, engaging in the political process is something that we can all do, whether that's running or voting, to support. I think I heard some different policy ideas throughout our discussion, like how do we make sure that people in poverty have access to the system? How do we make sure that people with Medicaid get the care equivalent to people with private insurance? There are a lot of policy pieces I've heard. And you all asked all the questions that I had remaining. So I want to open it up to continue that discussion. Go ahead, Patty. Somebody online?
Yes, we have another person online asking if we could speak to the requirements for healthcare providers to understand these disparities, including a deeper understanding and development of anti-racism practices and policies.
That's structural, and that has to start at the top of systems where the system leaders. I think we've gotten ourselves into a checkbox. Oh, they attended this training and they attended this training. That's not working. We really, really, really have to talk about race every day, the disparities, and require that employees feel uncomfortable around it. That's the way we can't continue to pretend like well, we will if the power and the privilege stays in place, but that's the way we are going to move through this at a little faster pace than we are presently.
I also believe too that we have to understand why is there different in the first place and have that ongoing conversation. Why are we in this situation in the first place? Why is there such a difference? Why is the system set up to make it a difference, and have that ongoing education, and then from that education and being taught consistently, training is being taught consistently from the top on down.
Yeah, because I think it's history that we don't necessarily want to look at. And I was watching a documentary the other night about Dr. Martin Luther King, and at one point, right in the middle of the civil rights movement, he wanted to leave the South and head up north to New York to fight poverty. And there was a housing complex up there. They had no heat. People were literally wrapping their babies in newspaper and bringing them to him. And so he was trying to figure out how to get heat on in the building. But a lot of the folks around him were like, Dr. Martin Luther King, we shouldn't be doing this right now. It's all about social justice. We've got to stay in the South. There's still work to be done. And what Dr. Martin Luther King said was, poverty and racism go hand in hand. And we've got to focus on both. And he got so mad at some of the folks around him that he hopped up and left the room, and they all went running after him. No, we're sorry, you're right, we need to do this. But he was adamant about that. And I'm thinking about that now as we're talking about race and healthcare, and how we have to just call it what it is. Poverty and race are hand in hand. And so while we're dealing with health and those disparities, there's no way to get around race. And when you're talking about race, there's no way to get around the poverty. And so how are we working so that we're coming full circle and identifying some of that? Some of it, to me, even just starts at that first line of defense of the workers that are answering the phone, the ones making the appointments, the first person you see when you go in the doctor's office, to me, need better training and support so that there's some compassion there. And we've missed that here in humanity, just compassion. If someone's nasty as soon as you answer the phone, do you want to make that appointment? So it's almost like you're fighting to get good health care just by getting through that first phone call, arriving, and the person's looking down and they don't even want to make eye contact with you when you're, getting ready to go back to be weighed, my favorite part of a doctor's visit. We don't talk about that enough. Is it what this woman was saying, writing reports and firing everyone because they're not offering good compassionate services? I don't know, but we don't talk enough about what it means just to be kind to someone and compassionate about where they're at right now. That they were brave to even pick up that phone to try to make the appointment. They were brave and courageous just to make it to the doctor that day. How can we serve them best as soon as they walk through the door?
That reminds me, because we are in a white dominant system, we are taught to be performative and productive. And so we have moved past kindness, gracefulness, compassion, empathy, and love, because we are told every day, what number are you bringing to me? And so part of healthcare is broken down, well, not part, a lot of it, because healthcare providers are told, how many people are you going to get coming through this door today? Check them off, them off. And if they're black and brown, check faster, right?
Lots of folks.
So I was going to go back to kind of this conversation about systemic change and policy and what does that look like. And voting is very important. I think I would challenge everyone to take it a step further. After we vote these people into office, we have a duty to hold them accountable for what they're doing.
Yes.
And we have ways that we can get involved with that. Right now, the Indiana General Assembly is in session.
Yeah.
Figure out what amendments are on the floor. Just this week, there was an amendment on the floor to help pay, the state would help pay women who are pregnant to get some of their medical needs covered. You know, if that's something that you're passionate about, you have the opportunity to go down there and testify before the people to advocate for how this would make a change in your life. They want to hear that testimony. They want us to be involved, and we have to hold them accountable. You know, voting them in is one thing, but then they also need to be doing the actions that we support, and we need to be making our voice heard on where our citizenship feels that we need further policy making and those types of things. And there's lots of organizations here in town you can get involved with to do that. You know, if you find an amendment that you're really passionate about, maybe talk to the Urban League. Maybe they're supporting the same cause, and we can get support and get people down to Indeed to testify. Call these representatives. Talk to them about how they're going to vote. Get more involved in that system to cause the change.
I don't think anyone will argue from over here. So, some questions in, go ahead. Yes.
I work with Antoinette, and I would really like to thank her. I don't know.
Oh, there you go.
Okay, so like she shouldn't have to, right? She shouldn't have to educate me. She shouldn't have to have
Right.
hard conversations with me, but she takes the time to. And I mean, we had a very candid conversation like a week ago, and she made me think about things that I don't always think about. And I really appreciate the tone she sets in our clinic for kindness and care and taking those time with all your patients. And I know what I feel. I'm a lesbian person, so when I walk in the hospital with my partner, it's not anything what happens to black and brown people. I'm aware, but I am also aware of what I feel even as a white person. And I grew up in that Boyd Township, and trying to educate some of those people, they don't even want to be educated, some of them, you know, and it's really sad because black and brown people shouldn't have to educate us about white people as how we should treat people well or share their stories. We should just treat all people well. And I just thank you for just being willing to educate us, because you shouldn't have to. So
My 31-year-old daughter says they get 2 questions, and then I'm sending them to Google.
I mean,
She's done after that.
it's really
Go
true.
figure it out yourselves.
Yeah, it's really true. People just don't want to hear that.
Yeah.
No one is saying you have white privilege because of anything you did.
Right.
Can you just hear that black people are not equal? We're not saying you did something. We're just saying hey, can you just listen for a second? So,
I say 12 generations of slavery, tobacco, and cotton, made your families wealthy, and mine poor.
well, and I think people don't realize how hard it is to be poor. People think, they're just taking advantage of the system. No, it's really difficult to be poor. Really difficult. Anyway, thank you.
So in my training, there was a pictorial of the systems in which a poor person has to touch by mid-morning, and most of us in here couldn't do it. We wouldn't make it. We make it impossible for our vulnerable, especially our black and brown people, to move out of poverty because our system is set up for them to stay there.
Absolutely.
So I would like to say thank you, Katie. Our team is phenomenal. I am so thankful for our team. We have a diverse team, and that's intentional.
Awesome.
We have 4 core values that we don't just have it as a platform for Bowen. It's what we live by every day, and that's stewardship, respect, integrity, and our mission. And I work so hard, our team, that we focus everyone that we walk through the door. That is our core values, even though our mission is to reach out to the community and help the underserved. So, Katie, thank you for that. We do have honest conversations because we have a very diverse, and it's not even just black and brown people, it's our immigrant and refugee families that come in undocumented, don't know which way to go, and we have a structured system here, you gotta have identification to be seen, but just being able to have an organization where you don't come in, we're going to help you. We have a 340B program that helps you if you don't have any insurance, or if you do have Medicaid, we're going to help you get that medication. Even if your bill come in and you can't afford it, we have grant funding to help you get that proper health care treatment. So it's just going over and above and beyond, and knowing what the needs of that population is and making it happen. That's how you build trust, when they know that you have follow through, that what they come in there to get, they get that good quality health care, and they have that voice, and we build that trust, and we have a system to build that trust, or being intentional about the relationships that we build that is geared towards their needs.
I just have a couple of comments. One is that you're right, it's up to white people to get educated, but there's also this interesting conundrum in society where we also say we need to be talking about race more. And so, like, I'm a woke white person, but I still have so much more to learn, and I don't always want to turn to Google. I want to turn to my friends too. So we get kind of that, we get two messages. Like, we should be learning on our own, which I agree, but we also need you to help us learn. So it's that, how do we do that? So that's really important. But the other thing I think about is back to the comment by the midwife who's not here, is, you know, maybe we need to be meeting with and holding the DEI directors that all the folks have been hiring all over town accountable, and saying, okay, what are you doing to better your workforce? What are you doing to better address health disparities? And, you know, I think about the Allen County Health Equity Coalition run by Sharon Tubbs. That is something that we as a coalition could be working on, is holding folks accountable, especially in our healthcare systems, to say, what are you doing to break down barriers for people to work here that are people of color, to improve care for people of color? I want to see it. I don't want these positions just folks sitting there. I want to see work done in our community.
I think those are really good points, and Sharon Tubbs isn't up here on this panel, but is really doing really great work through Health Visions. So she is a resource here in our community that I'm glad that we have her here. But you know, this issue of unity and working and learning together isn't something new, right? You know, when we look at the women's movement, white women and black women tried to work together, but black women had the extra layer of social justice for black people. And so while white women were fighting for rights and that kind of thing, black women understood it, but it was hard to just completely align ourselves when our black men were being lynched. You know, and so here we are, you know, in 2023, and sometimes it's still difficult to bring us together so that we can work together in unity. But that there's power in that. You know, even when we haven't brought up abortion, and we know that the abortion laws are affecting black and brown women more than any other population. And what we know is just because you ban abortion doesn't mean abortions don't happen. And so we're going to have black and brown people killing themselves and dying from infection because of self-inflicted abortions, you know? And so we need white women around us working for those equity issues that affect all of us, especially when we know that it's affecting our black and brown women at really high levels.
Aisha, I just want to add that wage disparity leads to health disparities. In the state of Indiana, a black woman makes 61 cents to the dollar of a white man, and a white woman makes 82. Our sisters need to speak up, and our brothers need to speak up and not tolerate this, because it leads to health disparities. Black women are more likely to live in poverty. And so those are some of the reasons we have such great health disparities, because we're tolerating these things that should not be tolerated.
I had a quick question, just for clarity. What I'm hearing is that we've hired DEI representatives and we've put black and brown people on our executive boards, but we haven't given them any teeth when we are putting them in these positions. So what I'm hearing is maybe we don't need to hold the DEI person accountable, but we need to say what policies are enacted so that they can do the work that they've been hired to do. Is that is that where we would be more effective to say, are we actually listening to the people that we are paying poorly to be in these positions? And how we as white people, especially in not-for-profits that are chief executive officers or sitting on boards, to advocate for saying, are we actually allowing the people that are highly educated and motivated to do the work to actually get to do the work that we're saying they've been hired to do? Is that clear as mud? But
Yeah, it's clear. And so I'll speak to that. Yeah, we are tokenized. When we get on boards and committees, we're tokenized, and they'll say, well, the person, Antoinette, is on our board. She spoke. But when we speak, we're not heard. We're silenced. And so that, again, we need advocacy and co-conspirators when we're in meetings because, anyway, even as a woman, it becomes a great idea when a man says it. And when a black woman says it, it is silenced. And then 3 minutes later, when the white guy says it, such a great idea. And so we need intervention. We need for our brothers and sisters to step in and say, that was Aisha's idea. That was Antoinette's idea. That was such a great idea. Thanks for affirming her idea.
Where's the funding?
Yeah.
We can put that idea into place.
Right, because I recently read a book called Decolonizing Wealth, and no more than 10% of wealth from philanthropy goes to black-serving organizations and black-run or non-for-profit run organizations. And still, the majority of our boards, and upwards of almost 90% of the boards on foundations, are white. So we have to have a voice from our white brothers and sisters to say, no, that we're going to start funding these healthcare initiatives, these education initiatives at a far higher level, because it's been so much inequity for so long. It's going to take us 400 years to catch up, if not 4,000. Thank you.
For those online, I heard that as white people, we need to do the work, listen, do the things people are telling us to do, carry those out, and then that would help move things forward rather than ignoring. Yes. So I think everyone here knows people, and it seems like this has been such a good discussion. I'm going to encourage you all to continue to have these discussions with other people in your life after this, but I do see one more person wants to talk, so let me give you the chance to do that.
Thank you. Hello? Okay. I just wanted to start by saying thank you, ladies, for speaking today and sharing your stories and your passion. It's been really great to hear. And I don't have a question as much as a little plug. So I work for Purdue Extension, and I've been hearing a lot of vote here and what can we do about policy. And I just want to say that we do have a community development educator who has a program that's called Know Your Local Government, and we are really, really passionate about community and bridging the gaps for people to understand how do we leverage ourselves to get our needs met. And so if you have a group, if it's just you, if you have a platform that anyone who would benefit from that information, please reach out to Purdue Extension. We have so much education that we want to share. And so if we could just get that information out to people and help them understand what's really going on and how they can really use that power of voting to get their needs met, it would just work out for everyone. So I just wanted to share that.
And I just want to say she's incredibly adorable. Children's Health Collaborative, along with Purdue Extension, we're working on a newsletter that we'd like to send out to everyone in the room.
Wonderful. I just want to say thank you now to our panelists, Antoinette, and Aisha. Let's give them a big round of applause. And thank you all for coming out today to have this dialogue, and I hope that you will continue these conversations.
Thank you.
Thank you. Thanks for
Thank you,
having us.
Mom and Dad and sister. They paid the way for me.
Thank you, Mom and Dad, for coming, sister.
And my Bowen family.
Yes. You had a whole row of support here. Didn't tell us.
Yeah. Yes.